Starting your 2 minutes time. One more page is there.
Okay, ma'am. Next page, ma'am.
Hello. Yes, started. Started timing.
Hello.
Hello. Yeah.
Hello. I'm Dr. Tanya, one of the doctor in the clinic today.
Hello, doctor.
Yeah. May I confirm your name and age, please?
Yeah, I am Jane and I am 47-year-old doctor.
How can I address you?
Jane is fine.
Jen, I think this is an unexpected call for you.
Yeah, doctor, and I'm really getting anxious and I'm worried also because they were supposed to give me the report after 3 months and now they had called me and rushed me in emergency. So, yes, I'm really worried. Is there anything too serious about it?
Um, Actually, I need to discuss with you a lot. Are you alone, or do you have someone with you who can discuss, who can attend our discussion?
And my partner, my husband is not here, doctor. You can, and my children are also not here. You can discuss with me only.
Okay. So, Jen, do you have any idea about the report?
No, doctor, but I'm scared.
Don't worry, Jen. We are here to help you and support you. So, Jen, before going to discuss about your report, can I ask few questions so that we can make our discussion more easier?
Yeah.
And at the end, I would document everything and give you the written information. And also, if I will give you the contact details, okay?
Oh, yeah, that's sound great, doctor.
So I can see that you have underwent the operation. So what about the recovery after operation?
Yeah, I'm very well recovered, doctor. I'm getting around. I'm doing my daily task also, and I'm looking forward to join my duty also. So things are pretty normal at my end.
Okay, fine. What about your waterworks?
No, nothing to worry about. Everything is fine.
Okay, any tiredness
No,
or any recent weight loss?
no.
Okay, may I know why this operation was done for you?
Yeah, doctor. Actually, I was having this heavy period since last 6, 8 months, and it was not getting controlled to the medical line of management. And then I had decided to go ahead with the hysterectomy because even I had noticed some bulge in my private area, so I had opted for surgery.
Okay, so any tissue sample was taken?
Yeah, they had done a biopsy 4 months back, and the report were normal, nothing to worry about.
Okay, may I know about your periods of that time?
Yeah, my periods were, I told you, it was very heavy, doctor. I used to bleed like heavily for 6 to 8 days, and then I used to get tired, anemic. I used to pop up pills also. Yeah, they were pretty heavy.
Okay, are you up to date with your smear?
Yes,
Okay, so may I know, do you have any medical condition
no,
like diabetes, high blood pressure?
no,
Okay, any personal or familial history of clot formation in the legs or lungs?
no.
Your weight height ratio?
It's normal.
Any allergy to any medication?
No,
Okay, and any history of cancer in your family?
no.
Okay, and what about your support at home, Jen?
Yeah, doctor, I told you I stay with my husband and I delivered 2 kids actually. So they all are grown up and they are self-sufficient. Nothing to worry about.
Okay, and what do you do for your living?
I am a store manager.
Okay, what about your social habit? Do you smoke?
No.
Okay, so Jen, I have gone through your reports. I have confirmed your name and NHS number. It belongs to you.
Hmm.
Okay, Jen.
Hmm.
Actually, Jen, I'm really sorry that I don't have a good news for you.
Oh my God, doctor, I'm scared. You're scaring me. Yeah, doctor, go ahead.
Don't worry, Jen. We are here to help you and support you. Actually, I have a serious concern about your report because the tissue doctor has seen the report, has done the report, and it's showing there is something concerning. Aro,
Okay.
actually, if you want, I can discuss today, or if you want, we can take another appointment.
So what you wanted to say, doctor? What I'm having actually?
Actually, Jen, uh, it's showing that it's the cancer of the inner lining of the womb.
God, is it my report, doctor?
I know this is really difficult for you to accept that.
Yeah, doctor,
Uh,
actually, it's
Jen, I'm
devastating,
really
doctor.
sorry that I'm bearer of this bad news.
Okay, yes.
So,
What
Jen,
next, doctor? What next? I wanted to know.
okay, Jen, actually, uh, from that point, what we can do for you, we need to uh, involve a group of doctors. We call it MDT, and
Okay.
involving the tissue doctor, our cancer surgeon, cancer and X-ray doctor, counselor, and specialist nurse. We call Macmillan nurse. All be involved in your care. Okay,
Hmm.
so we need to do some further test to evaluate your condition. We may need to do your chest X-ray and also some blood tests and one special test, advanced scan, that is CT scan. Okay, so it will be done. Actually, it will be done within 2 weeks pathway, and then the team of doctor will give your management plan. Okay, Jen?
Okay, doctor. So, do you think this is a very advanced cancer? How much it has
No,
spread? Can
no.
you just tell me?
Actually, the Let me reassure you that this is the early stage of cancer, and your the survival rate is quite good, and that is 9 out of 10. Survival rate more than 5 years.
Okay. And
Are
do
you
I
following
need
me,
to
Jen?
yeah, do I need to go undergo any other treatment, doctor? Because I had already removed my womb.
Actually, the group of doctor, that was MDT, may want to do uh, surgery for you because already the cancer containing womb has been removed. We need to remove your ovaries, and that can be done by keyhole surgery. As this tumor is hormone sensitive, so we need to remove this hormone producing ovaries. Okay.
Okay, okay.
And at
Uh,
the moment, no need to for further treatment like any cancer killing medication or any radiotherapy. But we need to follow up your condition because this cancer has a tendency to occur again. Okay.
okay.
So long-term follow-up is needed. So, Jan, actually nothing will be done without your permission, and we are all are here to help you and support you. Am I clear so far?
Okay. Yes, doctor, quite clear. Yeah.
So I would like to connect you to the specialist nurse, Macmillan nurse, and also with our support group. Okay, Macmillan Cancer UK, and also I'm giving you the patient information leaflets on endometrial cancer, and the our specialist nurse will do help you to do the further investigation. Okay, Jen.
Okay.
And Jen, I know this is the difficult time, so I would like to connect you to the counselor so that you can cope up with the condition.
Yeah, doctor. Thank you.
Uh, Anything else I can do for you?
No, I just yeah.
And if you
Um,
want, I can talk with your partners.
why they couldn't identify this cancer on the biopsy, doctor? They had done a biopsy 4 months back.
Yeah, I actually, sometimes we are doing the blind biopsy. In that cases, the cancer portion can be omitted. We can miss this tissue sample. Okay, so in that way, as it is a blind procedure, so it can be missed.
I'm giving you extra 1 minute, okay? Yeah. Okay, so that means they had missed the cancer actually. If it would have been picked up, I might have been gone ahead with surgery quite earlier, doctor.
Yes, but if you want, I can also initiate the incident report so that we can find out is there any lackings or is there any fault from our side. We can find out that.
Okay, doctor, thank you.
Okay, so I'm giving you the contact details and also documenting everything in your notes. Okay.
You.
Okay. Thank you for your time.
Yeah, thank you.
Ma'am, last question. I could not understand.
Yeah, I will discuss that also. Okay, now your
Okay.
own reflection, your own feedback. Then I will give my critical feedback.
Actually, regarding breaking bad news, always I become shaky. I
Yeah,
became
even
nervous.
I had mentioned that only, dear. Even I had mentioned that. Need to improve on breaking bad news. Good, I
Yeah, yeah.
did. I gave it to you this topic.
Yes, ma'am.
Mm, yeah. Okay. Then you have to practice this task only, Tanya, 100 times so that you will smoothen enough to break the bad news. Communicate with your clinical patients. Mm, okay.
Okay, ma'am.
Yeah. So apart from that,
I take extra 1 minute.
no,
And
okay, still okay, extra 1 minute because I wanted to ask you that question. That's the reason. Otherwise, if I would not have had asked you, you were quite well within time. But I wanted to ask you that question because many a times people find that questions to answer it difficult. Okay. Mm. Okay, so my
Okay.
feedback is Dr. Tania. Okay, 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 okay. So many times. Hmm?
I am
Starting
not
with
aware of that. Now I am aware of. Okay, okay.
okay, minimize, humming up, nodding your neck. These are the appropriate acknowledgement gesture what you are going to practice here onward. Remember that. Okay. BBN. You started with two questions in the BBN format first. I thought you are going to break the news, you are going to break the bad news in front of me, and then going to ask me the relevant history, and then going to discuss my care plan. You said two sentences of BBN, then you started eliciting the history, then you started ex- breaking half breaking bad news which you had done previously, then half breaking bad news you had done in the between, and then we had discussed the management plan. Okay, so answer key I will be discussing in detail. I want you to improve on your communication skill, Dr. Tania.
Yes,
Listen
ma'am.
to the recordings, listen to the recordings, the way we communicate. It is not your tone, I am not saying your tone, it is your way of communication. Hmm? Way of using sentences. A simple English language can be used. No need to use any extravagant English words. A simple language in a better way to communicate. That is what I wanted you from. I wanted it from you. Luckily, this time you were not deviated from your main task. You were quite pertaining to your task, and you asked me a quite relevant history and quite relevant on track. I'm not having any particular issue regarding that. Now I'm having an issue regarding the communication. So you were having two issues, Tanya, so far as it was not being on track, and secondly communication. You were on track this time, but the communication you need to improve. That is my critical feedback to you. Okay, because say when I said when some I whenever I used to say something now, the sentence was, do not worry, we all are here to help you out. If I'm saying I'm scared of situation, I'm scared it might be something very serious, do you think that sentence, do not worry, we are going to help you out, will be a ideal sentence or will be a suitable sentence, Dr. Tania? Rather than that, you just say, I acknowledge your fear, I acknowledge your anxiety. Give me a time, I will discuss all the options. I will discuss with you your case detail, your management plan. That sounds a suitable option. If you will say, if I'm saying something to you and you are saying, don't worry, we are all going to offer you help, don't worry. How can I not worry about myself when I'm having a cancer? You cannot say that you don't worry. You just need to acknowledge, I acknowledge your fear, I acknowledge your anxieties, I acknowledge your situation. Give me time, I will discuss the management. Do you want, or here you can just tell her if she's more anxious, if she's having more concern, so just tell her, do you wish to come along with someone so that we can discuss in detail? And if I'm saying, it has spread, and am I going to die, or am I going to have a limited time? Do not worry, something like that. The sentence when I said, na, it has spread. Do not worry, we are going to offer you help. I will re-listen or you re-listen that recording, Dr. Tanya. So this kind of sentence la go very contrast to the situation. Here, just acknowledge the concern, just acknowledge the feeling of that patient, and just tell her, I will guide you regarding the same. You're just giving her, you do not need to give me a reassurance that I am going to reassure you. This is not a reassuring station. Here, you are just going to give her a crystal clear idea that this is a stage 1 early cancer as per the histopathological report, and along with histopathological report, we need to evaluate you by MRI, not CT scan. With these two investigation, we will have a clear picture. And if it is a early stage cancer, then the chances, this is a very good means this cancer is having a very good prognosis. The chances of having a survival of 9 out of 10 in upcoming 5 to 10 years. Okay, so these sentences you are just going to tell me in a simple language. You get confused in this way. Okay, so that is what I wanted to tell you. So that communication you need to uh, precise. You need to practice that communication, Tania, doctor, here onward. Hmm? That is my critical feedback to you.
Yes.
Rest of the history was okay. The only history I wanted you need to ask me was intermenstrual bleeding and postcoital bleeding. That is a red flag of CA endometrium. Tiredness, weakness, weight loss, understandable, but IMB and PCB is important, dear, here. Hmm? Do not forget about that. Then BMI, hormone replacement therapy, you can ask hormone replacement therapy. CA cancer history is important. No need to ask history of clots in this case. Okay, BMI, allergy is important. Smoking, alcohol is important. Explaining, see here what they had mentioned here, explain histopathological report. So histopathology report you have to explain in detail, dear, not only a cancer. Okay, so that report needs to be discussed. Only saying cancer will not, you will not pass in this point number 2. People many a times ask why I failed, why I failed. So this way we actually forgot to do what they asked us to do. So here they had mentioned explain the histopathological report, and the report, entire report is this big. Okay, so it shows that some small foci in the womb which shows early stage cancer, uterus, along with that a small
Ma'am,
fibroid.
regarding the BBN, so when we are going to explain the report, so is that okay if we're going to start in that way, like the patient is not having the partner or something like that, and the patient is very scared, so we can say that we can arrange some clinical nurse for you, and we are, or
If
either
they're
the
saying,
counselor for
yeah,
you.
if you think they're very scared, then just offer them whether it will be okay if I can arrange someone. If they're okay, if a person you know that is very strong in front of you, then you can just tell her that okay, and you can just discuss the breaking bad
Yeah,
news. It's okay.
and regarding the report that like this is the okay that we can say that I can see your report, confirm your name, age, and NHS number. So we can see regarding your report that like initially start that I have a difficult news or the not the good news to talk to you. So we can say that we can see some sinister changes in your report, or directly we can say
Yes.
that there is the
No,
cancer
no,
in
no.
the report.
It is actually two breaking bad news, too short. Now, the first will be not a good report, and second will be sinister
Yeah,
change, and third will be
and then
directly say cancer. That is, this is a cancer of the womb, which is grade 1, and it is limited to the, draw here again,
inner
draw.
lining. Yeah,
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 it is
yeah, yeah,
again draw. That is, this is a womb and it has been stick to your inner lining. The no
yeah,
lymphovascular permeation is seen. That means the the tissues around the womb has as of now is clear of these cancer cells, and there is a small fibroid also which has been noted, and the cervix is also free of tumor. So this has
yeah,
all been, all need to explain, Dr. Tania and all of you. Okay. If they had asked you to do certain tasks, you remember you will be doing it in detail, not only explaining me the histopathology report that it is cancer. What is a type of cancer? This is a type of adenocarcinoma. This is a type of cancer. It is a early stage, limited to the inner line, and not has been spread to the surrounding lymph and blood vessels or the neck of the womb. So that all needs to be explained. Okay.
yeah.
So this is one point which you had missed here. Okay.
And
Doctor,
one thing more that
one important, sorry, yeah.
At a time, one
yeah,
person.
and one thing more that as the patient is having vaginal hysterectomy, so is
Hmm.
it okay? We'll confirm during the history, like we can see the notes that might be that the ovaries already removed,
No, no,
like
no.
the
They
salpingo.
will
No?
mention. No, they will mention. No, vagina hysterectomy with BS, so they will mention. So it, you will take
Okay,
it as that they have not removed the ovaries. Okay. You will
okay,
take
Uh,
it as
okay,
that.
okay. And regarding this report, mostly in the exam, the reports is coming in the same way, like in the detailed report. So just only the explanation that there is some sinister changes in
See,
inner lining of the
no,
womb,
if they had
and it's
asked
going
you to, no, if they had asked you to explain it, if they had given you that within next 10 minutes you are going, you have to explain her the report, then you have to explain it in detail.
like each
But
and everything, like there is
yeah,
the
so
like the
whatever
four, yeah.
information, yeah, whatever information has been given to you, just read it out in front of the patient and explain her in a simple lay language. It will hardly take one
Okay,
minute, not more than that. But that carries mark.
okay. Like there are some abnormal changes, and there is some thickening, and there is
Yes,
like
yes,
the
yes, yes,
yeah. Okay,
yes,
okay,
yes.
okay. Okay. Thank you very much.
If it has been in the instructions, if it has been given in the instructions, if it has
Like
not been
here, the
given, here they had mentioned in the instructions
yeah,
here.
yeah,
So
yeah,
in that case, you are going to give it a
yeah.
clear report. If it has not been given, then the gist of the report you can explain. Impression you can
Mm,
explain.
yep. Okay.
Okay.
Thank you.
Uh, Anybody
In
wanted to
the
ask
yeah,
anything?
yeah, I wanted to say that in this case, cervical smear history was very important and test of cure also was very important, I think, which we have
Why test
missed.
of cure? Test of
Uh,
cure.
be,
Why test of cure?
because
It is smear was normal. Smear was normal. No problem with my smear. My biopsy was done, which was 4 months back.
Mhm.
Which
Okay.
is a blind procedure. Biopsy is a blind procedure. We might not be able to pick up the area where the cancer has arrived.
Mhm. Okay, so test of cure only done when there was cervical
Normals, yeah,
cancer. Yeah.
abnormals.
Okay.
Yeah.
Mhm. Okay. Okay. Thank you.
Okay, Tania,
And
got your
regarding the
feedback?
treatment,
Hmm?
that as it's the
Yeah.
early changes, so we can say that we can arrange different blood tests like the kidney and the liver pathology, along with that the
Yeah, you
X-ray
can
and the
say,
specialized
you
scan,
can say
MRI.
anyways. Yeah, you
Yeah.
are going to
So if
require her all
everything is
investigation.
fine, yeah, if
Huh.
everything is fine, in that case, then we can say that we are not doing any other treatment, and we are just going to follow up you and attach you with the special clinic, right?
No, it is a MDT which will be deciding, reviewing your case details, and they might come up with a plan of removal of ovaries. That
Yep.
is
Uh,
laparoscopically because these are the estrogen sensitive tumors. So we need to remove both the ovaries. Okay. Ovaries removal may cause a menopause in her case. We can explain her. That will be a sudden surgical menopause in her case. We will discuss the side effect of removal of ovary, but that is a treatment which is recommended in her case as of now. Nextly, what you wanted to ask me?
and if in case like we discuss here regarding the grading, like if it is low
As of
grade, then there
now,
is no need.
yeah, as of now, we are looking, seeing a histopathological, it is early stage, low grade
Yeah,
cancer. So, most probably, she will not be requiring any further treatment. As of now, you can
yeah,
just tell her that looking as of now at her histopathological report, along with that, we will offer you a MRI, and if both the reports are in uh, they're going hand in hand or they're more or less the same, then she may not require any chemical drugs or any x-rays to kill the
radiation.
cancer
Yeah,
cells because it is an
yeah,
early
yeah,
case. So what she has said, we need to just follow you up.
yeah, yeah. Okay.
Okay. So that's the only thing what we are going to say. So now coming to the answer key, introduction was very nice. I will discuss the BBN, how exactly you are going to break the bad news. Okay. Situational awareness, very nicely you had acknowledged that I had a vaginal hysterectomy 3 week back and you had called me unexpectedly. I really liked the way you said, Tania. How are you doing and how I am recovering? Okay, any support I'm getting around with this surgery? No, I'm fit and fine. Here please acknowledge when I said I am fit and fine and I am planning to rejoin my office, or I am planning to rejoin my office. uh, because then you immediately asked me regarding any bladder work, something like that you asked me. What you asked me?
Yes.
Yeah,
What about your water work?
water work. Yeah, what about your water work? If I told you everything is normal, take it everything is normal, okay? Then you just need to ask me about the red flag signs and menstrual complaints, what kind of menstrual complaints I was having, what treatment I had tried, and vaginal hysterectomy indication, which you had asked me very nicely. Okay, setting agenda. Aim of the consultation to discuss the tissue report. Did someone discuss the report with you, or are you aware about that? Because checking her knowledge is very important regarding the report. Set agenda. So we'll be asking few questions and formulate a safe plan, management plan for you. Any specific concerns? No, I'm anxious, I'm afraid, because it might be a difficult news, it might be something very sinister. Here, rather than saying do not worry, we are here to help you out, just say I acknowledge your anxiety, I acknowledge your fear, we will discuss your report in a minute. Okay, this sentence sounds more uh, smoothing, or this sounds more
Yeah,
logical
perfect.
sentence.
Yeah.
Yeah, logical
Yes.
sentence. Okay, so sometimes you have to use these sentences. Then HOPF, high surgery access case details. Okay, menstrual history is very important. Here you need to ask the heavy menstrual bleeding I gave you. But what about PCB and IMB? What about my smear? Smear you asked me. Biopsy, when weight loss, loss of appetite, 4 months back. Okay. Then you had asked me BMI, HRT you miss out, high BP, blood sugar you asked me. Family history of cancer is important. No history of blood clot is important. Obstetric history is only for well supported at home or not. Smoking, alcohol is important. No need to ask about recreational drugs at this age. Okay, now coming to BBN here, Mrs. Jain, we called you up in an emergency to discuss the report of your tissue. Do you have any idea? No. Do you wish to have someone with you? Because we are having lots of information to share with you. I confirm that this reports belongs to you. First shot, some serious concern has been noted with your report. We have, or the histopathologist or tissue doctor has seen some sinister pathology in your womb or in your report. The tissue doctor has noted there is a cancer in the lining of the womb, along with small fibroid and normal neck of the cervix. Here just pause, because you had mentioned about cancer, or here you can rephrase this also. The tissue doctor has noted that there is a small fibroid, a normal neck of cervix, but he has also noted that there is a cancer in the lining of the womb. Once you had mentioned about cancer, just give a pause, count 1 2 3 4 5 6 7 8 9 10 in your mind, and then ask her, will it be okay if we proceed, or would you like to have another appointment with your partner, with your husband? Can I arrange some water, tissue? Just wait for her reply. No reassurance. That is the biggest mistake people do it. No reassurance. Then after that, patient will definitely say, "No, doctor, you just continue. I'm okay." Yes, I acknowledge that this is a difficult news, but a good part here is it's a early. Looking at the report, it seems to be a early disease. An early cancer womb is having a very good outcome, and treatment is better. Hmm? With the modern medicine, the treatment is better. Uh, the histopathology or the tissue test is showing it is only limited. Here you can take a help of drawing, okay? Is limited to the womb, and it has not spread to the nearby areas. And the 5 year survival with this early cancer is 9 out of 10, which also needs to be confirmed with the help of MRI. We have confirmed this is early cancer with the help of tissue test. Now we will confirm it with the help of MRI. Okay. 7 in 10 will survive more than 10 years. Okay, so this 5 year is 9 out of 10, and 7 out of 10 will survive more than 10 years. So cancer MDT. Now what next is 2 week pathway. We will be having a target pathway, that is 2 week pathway. Cancer MDT will be called upon. You have to take a name of doctors who will be the part of this. I had not mentioned here, but you have to take it. See, and we will be reviewing your biopsy. uh, since it is a blind procedure sometimes, and it is not done under camera, So it might have missed the cancer area. It is one of the possibility. But a tissue doctor in cancer MDT will also review your biopsy report. Hmm? So that is one answer what you are going to say. Incident reporting will not be an option, dear, here. Incident reporting, if there will be a mismatch, if there will be a cancer which was missed on that reporting and they had given a normal report, then you are going to do a incident reporting. Here, because it was not direct detected at that time, so the appropriate answer here will be the tissue, your biopsy will be reviewed by cancer MDT people. We'll see whether we had missed out on something. And secondly, since it the biopsy might have missed the small cancerous area, as it is a blind procedure, that is another possibility. Okay, so these are the two possibility. We will come up with the reviewing report of your biopsy tissue. MDT components, 2-week pathway, MRI will be arranged along with further investigation. The modality of treatment in early stage cancer womb is removal of womb and ovaries, as ovaries is a source of estrogen which causes recurrence of the cancer. Preferred mode of surgery will be a keyhole surgery here. Removal of both the ovaries, as we have only removed womb and left ovaries, we have kept the ovaries back, as cancer growth is hormone estrogen dependent, so we need to remove both the ovaries. In your case, we may just follow you up with MRI and see any abnormalities noted and acted accordingly. As of now, surrounding lymph node blood vessels being not involved or not spread to the cancer outside, but MRI is only will only explain us about the spread. So here again we are emphasizing that MRI is a treatment choice of investigation what we need to do to stage that disease appropriately. If it is early stage, less likely she will be needed a radiation or chemotherapy. We, as you had rightly said, we will just have a close follow up. This is a overwhelming journey full of lots of ups and downs. So I can offer you Macmillan Cancer Support Network is a people who had similar situation, and Macmillan Cancer Nurse Counselor will also be a part of your journey. They are saying nowadays, there was one talk where they are saying, the patient who are diagnosed with cancer endometrium will offer a genetic testing. So I had added this point extra here so that she gets screened for cancer gene. Any other concerns, we will discuss that. Give you PIL regarding the cancer endometrium. Arrange MDT. Further communication will be with my consultant. Arrange MRI also, and meanwhile you can get in touch with the support group and counselor. And any other contacts, any other queries, you can contact us or contact to the hospital and have a follow-up meeting. So this is actually a closing task. Okay. Now coming to the domain wise scoring. Okay.
Doctor,
Anxious
can I
or
ask?
sensitive. Just wait, we will just finish off with this and then we will come have the queries. Anxious sensitive BBN approach, explaining in lay language what HPR means, mentioned unexpectedly, mention it as cancer, not sinister pathology. You have to mention cancer or any serious concerns. Rather than that, mention cancer. Support and counseling, providing support and counseling, checking understanding at frequent intervals, caring, empathetic, and while objective will neither be unnecessarily optimistic nor pessimistic. That is our objective. The competent candidate should not talk constantly, inviting questions and appreciation at times, to interpret the histology report result for the patient by applying their clinical knowledge. So there they want you to apply your clinical knowledge to test, to mention it that it is early stage, offering PIL and support group. Information gathering, basically whatever information has been given to her in the form of investigation and GP in the case detail, relevant history regarding bleeding, smear, treatment tried, and biopsy. This is my red points. Okay, whatever I had mentioned in red or bold points, they are most of the times they are the important points. Okay. Risk of asking concerns, fear, expectation. it is important that early consultation the competent candidate find out what the patient already knows or suspect. So I am worried about it might be cancer, that is my worry, my concern. So they can ensure the patient has all the information they need to be able to explain the diagnosis, initial steps in further investigation and treatment. So you have to also inform, gathering means you have to guide a plan, you have to offer them a line of management how you are going to proceed further. Hysterectomy was done for failed medical line of treatment for heavy and regular periods. So that is also information gathering. All her smears were normal, and biopsy was also done 4 months back. That is also information gathering which you could able to elicit. This will be give a good candidate an opportunity to explain the patient that even if all investigation have been normal, it is still possible to have a cancer. Hmm? Patient safety, confirming identity, signposting at an appropriate time, no reassurance. This is important. What are the principles of MDT? Need to discuss histology, further imaging. More likely will take give us a definitive management plan. Okay, not CT scan, it is MRI. CT scan in CORE, stimulated by estrogen, so BSO, and the mode of surgery will be laparoscopy. MRI shows evidence of lymphadenectomy, then it might be lymphadenectomy might be done at the same time for the treatment. So the further treatment, that is radiotherapy and chemotherapy, depends upon the staging, final staging. Okay, most of the time the initial surgery will be along with BSO will be the complete surgery. Uh, and also that is BBN format. Okay, they are not alone, they are with someone, whether they wish to return with some their partner to understand the implication of the diagnosis. This is all also comes up in patient safety. If they are emotionally weak, then you can just offer them, we can rearrange your reschedule this appointment in upcoming week or in 1 or 2 days, and you can ask your partner, or you can ask bring your husband also. Knowledge of both pathology and possible treatment, they will able to explain that the tumor spread to an early stage. So that is applied clinical knowledge. Staging the histopathological report, that is applied clinical knowledge. It is only superficial invasion, no deep invasion. Further investigation will be MRI, which will be needed in this case, and having a good outlook, good prognosis, and the survival rate is 90% in 5 years. So this is what the whole task is about. Okay, I will just stop it. Now tell me what